with us now. Hello, Doctor. Thank you for joining us on the programme. No more money for nurses.
Yeah, and that should, I think the potential of nurses and potentially junior doctors going on strike should really be ringing alarm bells for a government. And at the very least, they should take a seat at the negotiation table. This is not like any other profession. And if nurses and doctors are saying they might go on strike, that's a critical warning sign for a health service and a bit of a distress signal for society at large. No doctor or no nurse wants to go on strike. And if they do decide to do so, well, then that should be a sign of something. For example, these are people who have committed to a career in providing care to others. They work early mornings and late nights, Friday nights and weekends to do a job that is almost by definition challenging but rewarding. And what we've seen in recent years, decades possibly, partly as a result of policy choices, is the job has become more challenging than it needs to be, perennially working an understaffed shift, and less rewarding than it ought to be. Quite significant erosion of take-home pay over the past 10, 15 years for nurses, for doctors. And that's what's behind this potential of industrial action.
The trouble with the NHS, though, is we love it. No one speaks badly of the NHS, but it's a big beast that however much money you put in, it always needs more. It needs to be reshaped, doesn't it, and reformed.
Right, yeah. This feels like a debate we have again and again and again. And yes, absolutely, we need to shift from a sickness service to a prevention-first service, right? The world has changed. There's more people need the health service, and complexity of disease has transformed. And that requires thoughtful prevention policy. At the same time, we've got this crisis in the NHS. We've got ambulances taking too long to get to people with heart attacks and strokes, difficulty seeing your doctor, your GP. We've got about 7 million people waiting for hospital treatment, right at the centre of that crisis for patients and people.
But that's partly because of the pandemic.
Well, the pandemic's precipitated that, but the reasons that crisis has come around is actually a 10 to 15-year story. Look at other comparable health systems. No one is seeing access problems like we're seeing in the UK across the rich world.
But nobody else in Europe employs as many people as the NHS does.
Right, we have a public health service, right? But my point is that at the heart of that crisis for patients is the problem of the workforce. 1 in 10 jobs in the NHS is vacant at the moment. Yeah. 1 in 9 nurses quit their job last year, right? There's no silver bullet to that. We can't fix that overnight. But that's not the same as saying we can't do anything at all. And in the short term, probably the most powerful lever you have is pay, right? So if you want to increase access to and quality of care for patients, well, then pay is something you have to think about for people that work in the health service. That's not to say we shouldn't reform the NHS and it's perfect. Of course it needs reform. We need to really change how we provide care. And that means a shift towards prevention services, thinking about the short term, the medium term, and the long term. What kind of services do I need to focus on to reduce the risk of these crises coming back every winter again and again? But the first step is really sorting out what's going on now.
Yeah, but the problem, Doctor, is there isn't enough money in the pot.
Right, well, yes, we're in this quite different economic environment. Borrowing is now a lot more expensive. Mm-hmm. So if we want to pay NHS staff more, you either have to raise revenue or you have to cut spending elsewhere. And as me and you and all your viewers know, cutting spending right now looks pretty tough. So we have to raise revenue. The problem is we've got a situation where instead of thinking about raising revenue, there's actually about £40 billion worth of tax cuts going on. So the conversation in the fiscal space is actually quite far away from where it is on the front line in public services, and that's a big mismatch.
But the NHS, even if there are cuts of potentially up to 15% in other departments, the NHS, we're being told, will be ring-fenced along with defence.
Yeah, but it's sort of shooting yourself in the foot, because the things that lead to people becoming unwell and needing the health service is about the conditions in which they live and grow, the conditions in which they work. It's about their housing, it's about schooling. The NHS can't be the last stop shop for all of society's ailments. And that's the kind of approach to the public services we have at the moment. So actually cutting spending elsewhere within the state isn't necessarily good news for the NHS or the country.
Can we, going forward, still have a National Health Service that is free at the point of use?
Yes, absolutely. What we're lacking is a coherent plan to achieve that. And that's lacking from all political parties. We've got the Labour Party saying they're going to do a 10-year plan, but we have no idea what's in that. We've got the Conservatives saying they want to put patients first, yet not thinking about pulling the lever that is probably the most powerful in terms of putting patients first in the current moment. So what we need is that coherent strategy with a set of policies that we haven't seen for at least about 15 to 20 years.
Good to talk to you, Doctor. Thank you very much indeed for joining
Thanks,
us.
Kate.
Thank you.